All right, in the studio with us, Dr. Eric Levike with Chiropractic Sport and Spinal Rehab, and today's program, Sport and Spinal Weekly. And an interesting topic here today. It's a good idea to point this out. The different types of services, or what other term did you use?
Yeah, services that we offer at the clinic. It's a little bit different from clinic to clinic. So if you come at our clinic, definitely you get. We'll talk about what kind of services we offer. We're a little different.
So we'll have that and more coming up on today's program. This is Sport and Spinal Weekly. Okay, we are back with this week's edition of Sport and Spinal Weekly. And before we took the break, we said we would talk about the different types of services at Chiropractic Sport and Spinal Rehab. And of course, the obvious one is chiropractic.
Yeah, the chiropractic adjustments or spinal manipulations. We do extra spinal manipulations as part of the treatment as well when needed. I think Dr. Erickson mentioned something about treating knees, elbows, and ankles, I think in a previous program. But chiropractic adjustments are bread and butter for sure, are the main service that we provide. Something a little different as well that other clinics don't, offer is the myofascial release, the deep tissue work that we do at the office, the myofascial release techniques that we use is very, very efficient on chronic pain and people that have tried prior chiropractic, acupuncture, massage therapy, didn't really get the relief, permanent relief. Just kind of temporary relief, and then mixed with chiropractic adjustments, the myofascial release, extremely, extremely efficient.
What's the type of client or patient that has that type of service, like someone that has fibromyalgia?
Yeah, some fibromyalgia, we do treat definitely patients that have that condition. A lot of times it's mixed in with myofascial pain syndrome or chronic pain, in the soft tissue.
Okay.
Which can be caused by injuries. Most common cause is injuries, trauma for sure. Simple as car accident or fall or work injury and repetitive trauma as well, or bad posture or things that could trigger that muscle to overwork or definitely work more than it should. Then inflammation sets in, and the muscle is trying to do its job, but it can't like 100%. So the first signal that the patient will sense is pain. Of course, you'll have pain, tightness, and stiffness. So that's pretty typical of myofascial pain syndrome, and then we'll address that at an examination and definitely. Figure that out early in the process so we can provide the right services.
That's two, right? Is there another? Is there some other services?
Yeah, definitely. There's we do have laser therapy that we use on. Laser therapy is pretty much a physical therapy modality, or a modality that promotes healing and decreases inflammation. Several medical journals have published statistics and studies on that lately. That it's definitely efficient on chronic and acute conditions as well. So we do have as well rehabilitation at our office, core stabilization. So when the patient is out of pain, make sure that we stabilize and strengthen all these muscles so the problem doesn't reoccur. So that's a very important aspect of the treatment. Make sure that people remain well. Yeah, stay well.
And then with each of those is also, you guys, I know that I'm aware of, you guys have different types of tools or new devices that the industry has provided, correct, to help you guys?
Yeah, we do have the only decompression table north of St. Cloud. I'm pretty sure we're the only one that has a spinal decompression table as well. So for treatments of disc herniation, acute facet syndrome, which is acute low back pain with a lot of inflammation, extremely efficient when the patients are picked well and you really know what you're dealing with. Then that decompression table is amazing on many conditions.
And of course, I mean, you guys all the way to you guys were doing sport physicals.
Yep,
This
sports
fall,
physicals and
or earlier or later this summer, just a few weeks
DOT
back.
physicals as well for truck drivers or
Huh.
to get your license for cleared for be illegal to drive on was it Department of Transportation? Yeah, definitely. So we do all those as well.
One of the athletic teams, I know that you guys have your hands in some athletics and athletes around.
Yep. Season has started, so we're going to treat BSU athletes on a regular basis and other athletes in town as well, high school or other age. Doesn't really matter, but we do a lot of work with BSU as well.
So that's just kind of all the things that you guys do in a nutshell, real quick.
Yep.
And if people have more questions, they can always call the clinic, and that number is
444-2117.
And of course, the topics that we discussed today, obviously, will be available at a person's fingertips right at the end of their mouse on the website. They will see all the services and probably some more stuff that we didn't even talk about
Definitely.
today. They can get there, and today's broadcast will be a podcast available on the site. Maybe that's how you're listening right now. So either way, you can get even more information at the website and the website is sportandspinalrehab.com. Well, Dr. Levaika, thank you for coming in today.
Yeah, you're welcome, Mark. Thanks for having me.
And we'll see you again in a couple weeks.
Perfect.
Well, that wraps up today's program. We'll be back next Friday. And here we are in another beautiful weekend in northern Minnesota. And I suppose folks will be heading outside. Do you have any tips for individuals? I don't know, maybe even doing some raking or starting to get ready for the fall months ahead.
Just take some breaks.
There you go.
Do little by little. Don't do, 3 hours of this and 3 hours of that. Just, gonna break it up a little bit. I think that, use your knees.
Stop and enjoy the season, right?
Exactly.
Thanks for coming in. You have a great weekend.
Thank you.